Good evening, friends. We'll start with today's session. Are you getting my voice clearly? Just check and say yes. There is little bit noise around, but we'll still continue with our session. We're discussing since last two lectures the mental diseases, right from aphorism number 210. And we have finished the 210, 11, 12, and 13. He started explaining about that how to manage the mental diseases. And while explaining this, he explains that the way you deal with the physical disorders, the corporeal diseases, in the similar manner, you have to deal with the mental diseases. The physic and mind, they are not two different entities, they are one and same. So, when you deal with the physical disorders, we used to take into consideration the state of disposition and mind. In the similar manner, when you deal with the mental diseases, the same is true. You have to take into consideration the vice versa, both the things, the physical as well as the mental aspect of the human being, the nature of the human being, which is expressed through his state of disposition. And that's what you have to catch. That is what is a very important thing, which is necessary to tackle all those disorders. And that's why he has concentrated over the state of disposition and he tried to explain exactly what do we mean by state of disposition. In last footnote, where he has explained certain examples of aconite, the aconite will not come to you in a calm and quiet way. Aconite comes into you in a panic state. Chamomilla is not at all quiet child. Chamomilla is a weepy, cried, shrieking child. That is the state of disposition of a chamomilla. The nux is very active, quick to act, very alert, very enthusiastic, very fast, very irritable, very sensitive. Nux is not like a dull, slow. So states are very important to understand. If you are able to catch these states, whether the patient is acute or chronic, you are going to get very right remedy. If you are dealing with the acute, you can immediately give the remedy. If you are dealing with the chronic, you have to think about the miasmatic background at the same time, and then you have to prescribe. But state of disposition and mind is always reflected according to the miasm and according to the constitution. So it definitely reflects exact remedy. And that's why Hahnemann says one should not miss the state of disposition and mind. And that happens to be there with the four qualities that already we have discussed, the four qualities for chronic case taking. The first quality which he has explained is the freedom from prejudice. The second quality which he has explained, the sound senses. The third one, that is attention in observation. And the fourth quality, that is fidelity in tracing the picture of the disease. And those four qualities develops your perceiving power. If you perceive the power, it becomes quite easy to catch the remedy. It is quite easy to reach to the perfect simillimum. And that's why Hahnemann explains the state of disposition and mind plays a very vital role, whether you tackle the physical disorder or whether you tackle the psychological disorder. This plays a very vital role. So this is what we have discussed up till now, up to the aphorism number 230. Let us go avoid the 214. The instructions I have to give relative to the cure of mental diseases may be confined to the very few remarks, as they are to be cured in the same way as other diseases, namely by a remedy which shows by the symptoms of its causes in the body and mind of the healthy individual, a power of producing a morbid state as similar as possible to the case of the disease before us, and in no other way can they be cured. So now he starts explaining how to go ahead with the treatment of mental diseases. And very important thing which he defines over there, that the way you treat any chronic disease, in the similar manner you have to treat the mental disease. There is no difference. So if you are tackling or if you are dealing with any chronic one-sided disease, the physical disorders, in the similar manner, you have to deal with the mental disorder. Your remedy depends upon the same thing. You have to take into consideration the patient's state of disposition and mind. You have to take into consideration all 7 points which he has explained in the fifth aphorism, how to investigate fundamental cause. And at that time, he has explained the 7 fundamental things in order to understand the fundamental miasm. That is ascertainable physical constitution, his moral and intellectual character, his occupation, the mode of living and habits, his domestic and social relations, then his age, and lastly the sexual function. All matters because that gives you individuality of that human being. And those are very important. That is what you have to develop, that perceiving power which you have to develop in order to catch the exact nature of the person and with which to match it with the right remedy. The simillimum is based upon all those things. And that simillimum is the patient's simillimum, whether he is suffering from physical disorder or whether he is suffering from the mental disorder. So there is no so much difference when you deal with the mental disorder. So you have to approach with the similar aspects. Only few hints are there according to the types of mental diseases. He has classified mental diseases into 4 types, and accordingly, how one should approach in each variety of that mental disease, that he tried to explain in further aphorisms. So we have to understand all those things. So in this aphorism, he specifically mentions that there is no difference in the homeopathic management of mental diseases because it should be treated as similar as the corporeal disease. So this is what he wants to explain in this 214. Let us go with the 215. Just write on your book, first type of mental disease. So he starts explaining about the first variety of mental disease. Aphorism 215. Almost all the so-called mental and emotional diseases are nothing more than the corporeal disease in which the symptoms of derangement of the mind and disposition peculiar to each of them is increased, whilst the corporeal symptoms decline, and more or less rapidly, till it at a length attains the most striking one-sidedness, almost as though it were a local disease. In the invisible subtle organ of the mind and disposition. See, what he is explaining is very important. The first variety of mental disease. What he says, first sentence, almost all the so-called mental and emotional diseases are nothing more than the corporeal diseases. So they are part and parcel of the corporeal diseases which are getting converted into the mental diseases. This is an expression of the corporeal disease which is turning towards the mental disease, in which the symptoms of derangement of the mind and disposition peculiar to each of them is increased. So a patient who is suffering from the liver cirrhosis, and if you try to do certain things, many a times it happens, you observe that those patients where liver cirrhosis is marked, the ascites is marked, and there are many medicines they have tried to treat that patient, and sometimes it changes the axis of the disease, and then it enters inside the brain. Then then the person becomes sometimes violent. The person becomes sometimes dull, sometimes stiff-lipped, sometimes very cursing, swearing. It varies. It is not one and same, but it changes its action, going from pathology, the physical pathology, turning towards the mental and emotional plane. In fact, this is more dangerous, more harmful, because this is a shifting from the physicals to the mental, from the material to the dynamic aspect. And once the disease goes from the physical plane to the mental plane, it is in fact very difficult to tackle. Many such disorders, the paranoid schizophrenia is there, the chronic depression is there, the obsessive compulsive neurosis are there, and these are many a times These are results because the physicals are suppressed and it enters into the mental plane. And such varieties of disorders are very difficult. If one patient of paranoid schizophrenia is there in the house or in the home, it is quite difficult. That whole family gets spoiled. The problem happens. Even OCD, if a patient is having the OCD, one of the patient is having OCD, the whole family gets disturbed. And such grave effects happens to be there because of mental and emotional diseases. And that's why the conversion of a corporeal disease into an emotional plane or mental plane is rather hazardous and dangerous for the life of the human being. And this is the first variety which he explains, that the corporeal disease in which the symptoms of derangement of the mind and disposition peculiar to each of them is increased, while the corporeal symptoms decline, most more or less rapidly, till it attains the most striking one-sidedness, almost as though it were local disease in the invisible, subtle means sukshma, subtle organ of the mind and disposition. So disease is going into the mental plane. He explains that mind and organ of mind and disposition. Organ of mind and disposition is nothing but the mind. It is there in the upper half of the body, in the upper part of the body, in the head, because it is closely related with brain of the human being. And that it gets converted into such a dynamic plane, subtle plane, that this disease is rather difficult to cure. You will going to find it out one word whenever you deal with the psychological disorders. Many times you get three important names for the causes of diseases. Either they say it is idiopathic. Second, either it is autoimmune. That is, these are the words which are they are trying to utilize, because they never consider that there is a chance that physical disorder disappears and it turns towards the psychological disorder. It turns from one plane to another plane. It is a change of axis. So it goes from one plane to another plane, affects the human life. And if it is so, then it is rather difficult to treat. Then it is quite difficult and to handle. You observe that patients who are of OCDs, who are of paranoid schizophrenia, who are of the part and parcel of anxiety neurosis, who are the deep depression, you've just observe those patients, how they treat at the with the psychiatry. You observe that there are pills which only just sleeps them, which with which they become tranquilized and drowsy. They cannot think properly. They are confused. There is dullness, slowness. You observe these patients goes on putting on weight, obesity develops. They become drowsy. They become sleepy. Even whole day they sleeps many a time. They are not able to communicate with the others. Such hazardous effects are there in treating the mental diseases, and this is the first variety of mental disease where the disease has transmitted from the physical to the mental plane, corporeal to the mental plane. And such a disorder is quite difficult to treat. And this is the first variety of mental disease which Hahnemann have explained over there. So the first variety, which is transmission of the disease from the corporeal state to the mental state. Now, what he explains about it in the 216, we'll finish this aphorism and we'll stop. The cases are not rare in which so-called corporeal disease that threatens to be fatal, a suppuration of the lungs, or the deterioration of some other important viscous, or some other diseases of acute character, example in childbed. Childbed means it is a puerperal fever. The fever happens in puerperium, is childbed, becomes transformed into the insanity, into a kind of melancholia, or into a mania by rapid increase of psychical symptoms that were previously present, whereupon the corporeal symptoms lose all their danger. The latter, that is corporeal, improve almost to perfect health, or rather they decrease to such a degree that their obscured means anduk, aspashta, that their obscured presence can only be detected by observation of a physician gifted with perseverance. Perseverance means shikati and penetration. So he is explaining the examples of first variety of the mental disease. Many a times this happens that you observe such a thing, that a chronic disease where death is imminent, or sometimes it is very dangerous for the patient's part of, and they give some allopathic medicines and it shifts, yes, it starts recovering and patient goes into the insanity. Insanity is more dangerous than the physical disorder, because once the patient becomes insane, then it is quite difficult to handle. Insanity is nothing but the madness. So if a person becomes mad, violent, there are many types of manias. There are violent manias like in case of belladonna, the lascivious mania in case of hyoscyamus, the religious mania in case of stramonium. So such varieties of manias are there. Patient can enter into such types of manias, insanity, and it is at the same time you observe that his physical disorder is disappearing. It is becoming obscure. It is not it is not strong as it was earlier. This is the shift of axis, and this shifting of axis is very dangerous from patient's point of view. What he further says, in this manner they become transformed into a one-sided and as it were a local disease, in which the symptoms of the mental disturbance, which was at first but slight, increase as so as to be chief symptom, and in a great measure occupies the place of the other, that is corporeal symptom, whose intensity it subdues in a palliative manner, so that, in short, the affections of grosser corporeal organs become, as it were, transferred and conducted to almost spiritual, mental, emotional organs, which the anatomist has never yet and never will reach with his scalpel. Very nicely he has explained about the thing. What he said, that disease has transmitted. This has been transformed from the corporeal organs to the organs of a mind. It has transformed into the emotional plane. It has transformed into the mental plane. And now this disease is not visible in the form of any material. Generally all allopaths, they used to find it out what is wrong with the pathology, what is wrong with the cells and tissues. And if there is anything wrong, they tries to use the scalpel. They tries to remove that organ. They tries to remove that the tissue. But he says that this is the organ which is not visible to anyone and will not be visible to anyone. And that's why he has commented over there that no scalpel can lead towards there. No scalpel can remove this mental emotional plane. And the disorder once goes over there, it becomes one-sided. It becomes very difficult to tackle. Patient comes to you in such a manner that it is rather difficult to handle him. Many times in such types of cases, you require the institutional treatment. This is not so simple to treat. First variety of mental diseases are not simple one. They are the most difficult disorders to treat, because the person enters into an absolutely different plane, and that plane is rather difficult to tackle, because many times the patient can become violent. Many times patient is in such a state of melancholia, he refuses to take the medicine. If you start consoling him, his problem gets aggravated. If you start communicating him, he feels that you are his enemy. Such a blunders are always there with first type of mental diseases, and that's why they refuse to take your treatment. And these are the cases where mental regimen plays very vital role. And that's what Hahnemann have explained, how to tackle such types of disorder. At the end of explaining of these four types of mental diseases, then he has explained about the mental regimen, and that mental regimen is very important. See how much Dr. Samuel Hahnemann have thought regarding the managements of all those diseases. He has not just given, yes, you give the antisoric remedy and that's all. No, he explained that you have to manage that case. You have to give the time, how to talk with them, how to behave with such people who are suffering from mental disorders. All things you have to take into consideration. And this is what exactly the Hahnemann expresses. So this is the first variety of the mental disease, where disease transmits from the corporeal disease to a mental variety, emotional variety. So where disease goes from the physical plane to the mental and emotional plane, a difficult one-sided disorder to be treated. And this is the first variety which he tries to explain. I think we'll stop over here, because this we have to, there are three more aphorisms which are devoted to this first variety of mental diseases, that we have to understand in detail, and we have to learn all those things. You have to give a lot of time to tackle such types of disorders. If such a patient comes to you, you have you have to talk with him. You have to listen. Basically, listening is a very important criteria which you have to develop when you such types of patients are there, because they expect that you must listen them, and if you are not listening, then it never happens. And that's why such types of patient, it requires rather a long time or big time to be given to those types of patients. So I think that's all for today's session. We have started discussing about the mental diseases and first variety of mental disease which we have discussed. And he explains over there, you have to handle the patient in the similar way as you used to treat the corporeal disease. Only thing is that you have to understand what variety or which variety of mental disease from which patient is suffering from. Okay, so that's all for today. If there are any queries, we'll have a discussion. Otherwise, we'll stop. And my suggestion to all of you, please join today's session at night 9 o'clock, where we'll have a very good session on the Aurum group. I will share the case which is very interesting, with which all aspects of the Aurum are getting covered. If it is not possible to finish the Aurum totally in today's session, there will be one more session on next Thursday regarding the Aurum. So many aspects of the Aurum we have to learn in today's session. So, and second thing, you ask all of your friends to join. The same password and ID which you have just joined, same password will be there for the night session. Be there sharp at 9 o'clock, and we'll meet and we'll learn Aurum and how Aurum behaves, and what are the problems with which Aurum presents. A wonderful case, in fact, most pathological case which I have treated in my life. So thank you being there, and we'll meet at 9 o'clock. Yes, Nisha.
Yes, sir. No any query, but only my request is that while discussing about mental diseases, please share some cases, sir.
Definitely, but we have to
Which
finish
you have
one by one. If we finish, after finishing the first variety, we'll discuss the cases. There
Okay, sir.
are
Okay.
three, four aphorisms still remaining regarding the first variety. After finishing that, we'll have a discussion on cases. Definitely. So thanks everyone.
Okay, sir.
Be there at 9 o'clock and ask your friends to join. And one more thing, the Sunday seminar is postponed to next month. So this Sunday, the Pune PHA seminar, it has been shifted because of some technical problems which have aroused over there. So thank you everyone being there. We'll meet at 9 o'clock. Thanks a lot.